Well, doctors say mental health is a hidden crisis in much of Africa, but health workers in Zimbabwe have been offering private therapy at clinics in Harare. A trial conducted by the University of Zimbabwe shows the therapy can lead to big improvements in mental health. VOA's Henry Ridgewell reports.
Doctors estimate 1 in 4 Zimbabweans suffer from depression or anxiety, but there are just 12 psychiatrists treating the country's entire population of 14 million.
We can't possibly go the route of training psychiatrists and psychologists because it would take 15 years. How are we going to provide treatment?
Local doctors have come up with a simple but seemingly highly effective idea. Wooden seats, so-called friendship benches, were installed on the grounds of several Harare health clinics. Visitors were offered 6 one-to-one counselling sessions with lay health workers who have received some training. They are known as grandmother health providers.
The very lowest cadre of the health system to train those women to offer problem-solving therapy, and so the patient explains what all their problems are, and it's opening up the mind in the sense of allowing the patient to see that they can do something about their problems.
The study involved more than 550 patients. After 6 months, only 14% of the patients in the Friendship Bench group reported symptoms of depression, compared to 50% in a control group. They were also 5 times less likely to have suicidal thoughts. Co-founder of the Friendship Bench program, Dr. Dixon Chibanda of the University of Zimbabwe, told VOA via Skype the intervention had a wide range of benefits.
Not only a mental health sort of package, but a package that actually improved outcomes of things like hypertension, diabetes, and adherence to medication for people living with HIV.
That success has led to friendship benches being rolled out to 60 clinics in Harare and 2 other cities. The Canadian government is helping to fund the expansion through its Grand Challenges Canada aid program.
It's going to be, we think, one of the biggest programs for mental health in sub-Saharan Africa.
Researchers say it could be a blueprint for mental health in low-income regions and could also offer lessons for treatment in richer countries. Henry Ridgewell for VOA News, London.
I'm Joke Rogers here at Channels Television, and you're watching Africa 54. Late last year, 5 West African countries put an end to imports of refined petroleum from Europe in a bid to improve the quality of the oil coming into their markets. Some residents of Togo say they're in support of their government's ban because inferior fuel can take a toll on their vehicles. Here's our report.
After a recent finding that fuel imported from European companies contain high levels of sulfur, Togo, alongside Nigeria, Ghana, Benin and Ivory Coast, joined in on an import ban of toxic fuel. Emissions of sulfur particles from diesel engines is one of the major contributors to air pollution.
This is a very good decision because toxic fuel causes too much damage.
The UN Environment Programme applauds the move, saying it will help more than 250 million people in the affected countries breathe safer and cleaner air. In Togo, many residents are in support of the decision, especially those who say their cars have been damaged by toxic fuel.
We often have to change the engines which are damaged by the toxic fuel, and all of this really affects our work. People often have to change their car engines because of the damage.
Air pollution can be a problem in heavy traffic, typical with some of Africa's biggest metropolis, a challenge African governments strive to address.
With that decision, we will be more watchful and insist that the government respect this commitment. Because it's one thing to make that decision, it's another to implement it. We must also establish checkpoints and a better monitoring system to control the quality of fuel that is imported into the country.
Alongside necessary standards, better quality drives up costs. And with many nations facing severe shortages in public finances, analysts say there are concerns about angering people with higher pump prices.
While you're watching Africa 54, I'm Vincent McCory in Washington. In the northern U.S. state of Minnesota, 2016 was a pivotal year for a former Somali refugee. In November, Ilhan Omar became the first Somali American to win a seat in the Minnesota State House of Representatives. VOA's Ken Farabaugh has that story.
And if you could please say "I do" after I finish.
With two simple words, Ilhan Omar took her place in the Minnesota House of Representatives, accomplishing what few people thought possible during an election year that put Muslim Americans at the center of heated political debate about immigration and terrorism.
The Muslim community needs a win.
Muslim American Society of Minnesota Executive Director Asad Zaman was one of dozens of supporters who watched Ilhan Omar
Do you solemnly swear or affirm
take the ceremonial oath of office on a commemorative Quran on the floor of the Minnesota House of Representatives?
I do. Congratulations. Welcome to the House of
The
Representatives.
ethos of America that can embrace a Somali American hijab-clad woman as their representative. I think that says something amazing about America.
The negativity of the 2016 presidential election campaign is now a footnote for Ilhan Omar, who views her role in the national conversation about Muslim Americans as a positive one.
It sort of provides a counter-narrative to say, well, all is not bad, that there is good, and if someone like Ilhan, who has all of the odds against her, can succeed, then, you know, we are able to see that as a country we do have a balance of both good and bad, and that we just have to figure out a way to come together and make sure that we are amplifying the voices of good.
While Omar is the first Somali American legislator serving in Minnesota state government, she did not win the support of the majority of the Somali American voters in her Minneapolis district. She was elected to her seat by courting voters outside the diaspora.
Politics is the art of inclusion, and Ilhan Omar has practiced inclusive politics, and she has been able to put forth a candidacy that is attractive to a largely white liberal group of voters, and she has convinced them that she is the best candidate.
She's also convincing others beyond Minnesota that anything is possible, something she says was reinforced to her on a recent visit to the Horn of Africa.
Hearing about young people who are running for elected office in Kenya and in Somalia because they were inspired by my race, I think messages like that truly put things into focus and sort of, I think, amplify the level and the magnitude of what we've been able to do here.
The magnitude of Omar's contributions as a state lawmaker in Minnesota is yet to be measured. But Zaman says Omar now has the attention of more than just the voters in Minnesota.
So this is a big deal. I think the whole world is watching what we're doing here today.
Which is why Ilhan Omar says one of her biggest challenges now is living up to all the hopes and expectations people have for her as she charts an historic path forward. Kane Fairbaugh, VOA News, St. Paul, Minnesota.
It's time now for a short break. Before we go, a reminder to visit our website, channelstv.com, for all the latest information around the clock. You can also find us on youtube.com/channelsweb. Still to come on Africa 54. In the Central African Republic, Christian and Muslim hip-hop artists come together to use their music as a call for peace and reconciliation. That story in a moment.